Good morning. Every day, millions of older adults around the world begin their day with a cup of coffee. It provides alertness. But what if this daily habit could be optimized? What if it weren't just a central nervous system stimulant, but also a delivery vehicle for therapeutic compounds? I am Dr. Sarah Mitchell, and for the past 20 years, my focus has been nutritional science and geriatric health. In my clinical practice, I consistently observe two primary factors that degrade patient vitality: sarcopenia, the age-related loss of skeletal muscle mass and function, and low-grade systemic inflammation, the foundational element of most chronic diseases, including osteoarthritis. And herein lies an opportunity. Your morning coffee, by its very nature, is an ideal delivery vehicle to introduce bioactive compounds into your system. Today, I am providing you with a 10-item toolkit. This is not a countdown. It is a toolkit of 10 scientifically validated ingredients you can add to your coffee. We will analyze, in depth, the mechanism of action for each one. In the next 18 minutes, we will learn how to biochemically optimize your cup of coffee. Let's begin with a familiar spice, Ceylon cinnamon. Many people regard cinnamon as a flavoring agent, but from a nutritional perspective, it is a potent blood glucose modulator. Why is this critical? Glycemic variability, that is, the sharp spikes and crashes in blood glucose, triggers a strong insulin response. This repeated hyperinsulinemia can lead to insulin resistance and promote a catabolic state, which is the breakdown of muscle tissue. Cinnamon, specifically Ceylon cinnamon, contains compounds that help improve insulin sensitivity at the cell membrane. It also slows gastric emptying, which blunts the rate of glucose absorption post-meal. This promotes a more stable hormonal environment, conducive to muscle preservation. A clinical recommendation: please check your labels. Do not use common cassia cinnamon. It contains high levels of coumarin, a compound which can be hepatotoxic, damaging to the liver in large doses. Look for Ceylon cinnamon, often called true cinnamon. It has very low coumarin levels and is the safer, more effective choice for daily use. Next, hydrolyzed collagen peptides. If you experience morning joint stiffness, if you feel joint pain upon movement, this ingredient directly targets that issue. Think of collagen as the primary structural protein in your connective tissue. It forms the extracellular matrix of your cartilage, tendons, ligaments, and skin. Unfortunately, after age 50, our endogenous collagen synthesis declines sharply. We use the hydrolyzed form because raw collagen protein is too large to be absorbed. Hydrolysis breaks down the long protein chains into smaller peptides, which are highly bioavailable. When you supplement with these peptides, you are providing your body with the specific amino acid precursors, namely glycine, proline, and hydroxyproline, needed for cartilage synthesis and repair. A 2018 review in the journal Nutrients concluded that collagen supplementation significantly reduces activity-related arthralgia or joint pain. The greatest benefit is that it is completely tasteless and fully dissolves in hot liquid. Now, let us discuss MCT oil. Do you ever experience temporary cognitive decline or brain fog mid-morning? This is often related to a decline in the brain's glucose metabolism, a common phenomenon in aging. MCT, medium-chain triglyceride oil derived from coconuts, provides an alternative metabolic pathway. Unlike long-chain fats, MCTs bypass the lymphatic system and go directly to the liver, where they are rapidly metabolized into ketone bodies. Ketones are a superb fuel source for the brain. They can cross the blood-brain barrier and provide energy to neurons, even when their ability to use glucose is impaired. Essentially, you are providing a high-efficiency backup fuel for neural function. My advice: start with a low dose, around 1 teaspoon. Too much at first can cause mild gastrointestinal distress. Blending. It in a blender will help emulsify the fat, increasing absorption. This next combination is perhaps the most well-researched natural anti-inflammatory agent. It is turmeric and black pepper. Chronic systemic inflammation is a silent physiological process. This is not acute swelling. This is a smoldering, low-grade inflammation that continuously activates pro-inflammatory pathways in the body, leading to tissue and joint degeneration. The primary bioactive compound in turmeric is curcumin. Curcumin is a powerful modulator of inflammatory mediators, including NF-kappa B. However, curcumin has one major flaw. Its oral bioavailability is extremely poor. Most of it is metabolized in the liver and excreted before it can work. The solution is in black pepper. Black pepper contains piperine. Piperine is a potent inhibitor of hepatic glucuronidation, the very metabolic process that deactivates curcumin. By inhibiting this enzyme, a tiny pinch of piperine can increase the serum concentration of curcumin up to 2,000%. This is a mandatory biochemical synergy. Now for an ingredient with pronounced cardiovascular benefits: unsweetened cocoa powder. I must be clear, not sugary hot chocolate. We are talking about raw cacao powder, rich in flavonols. Flavonols are plant-based compounds that have a direct effect on your cardiovascular system. What is their mechanism of action? They stimulate the endothelium, the inner lining of your blood vessels, to produce a molecule called nitric oxide, or NO. Nitric oxide is a potent vasodilator. It signals the smooth muscles of your blood vessels to relax, causing the vessels to widen. This effect improves endothelial function, helps to lower blood pressure, and enhances perfusion, the flow of oxygen-rich blood, to your muscle tissue and your brain. A study from Harvard Medical School demonstrated a direct link between cocoa flavanol consumption and improved cognitive function in older adults. This next ingredient is an emerging agent in the field of neuroscience: lion's mane mushroom, scientific name, Hericium erinaceus. While collagen supports connective tissue, lion's mane focuses on the nervous system. It is a medicinal mushroom that contains unique bioactive compounds, specifically hericinones and erinacines. What is remarkable about these compounds is their ability to stimulate the synthesis of nerve growth factor, or NGF. NGF is a neurotrophin, a protein essential for the survival, maintenance, and proliferation of neurons. As we age, NGF production declines. By supporting NGF, lion's mane has the potential to support neuroplasticity and neuroprotection, helping to combat age-related cognitive decline. All right, let's analyze the nutritional profile of ground chia seeds. If I had to pick one multi-target ingredient for overall health, this is a strong candidate. Chia seeds provide 3 critical benefits. 1. It is a complete plant-based protein, meaning it contains all 9 essential amino acids your body cannot produce. 2. It is one of the richest plant sources of alpha-linolenic acid, ALA, and omega-3 fatty acid. ALA is a precursor to anti-inflammatory eicosanoids in the body, helping to modulate inflammatory responses. 3. Soluble fiber. This is crucial. When mixed with liquid, this fiber forms a viscous gel in the gut. This gel slows glucose absorption, providing a similar benefit to cinnamon, and promotes regular gut motility. A critical note: you must grind them. The outer husk of the chia seed is very tough and high in insoluble fiber. Without grinding, the nutrients inside are not highly bioavailable. Next, another spice with pronounced pharmacological properties: ginger. Scientific name: Zingiber officinale. Ginger has 2 primary benefits. First, it is an excellent digestive aid. The acidity of coffee can cause indigestion in some people. Ginger has prokinetic properties, meaning it helps accelerate gastric emptying, thereby reducing the time the acid is in contact with the lining. But its second, more important benefit is its anti-inflammatory property. The primary bioactive compound is gingerol. Gingerol has been shown to inhibit prostaglandin production, acting on similar pathways as NSAID drugs, but naturally. When combined with turmeric, they create a synergistic anti-inflammatory effect, as they target different inflammatory pathways. Now let us not ignore the fundamentals. This is the simplest upgrade, but it is critically important, physiologically: milk or fortified soy milk. I see many older patients drinking black coffee to save calories. From a protein balance perspective, this is a mistake. Why? When you wake up, you are in an 8-hour fasted state. Your body is in a catabolic state, meaning your net protein balance is negative. Your body is breaking down muscle tissue for energy. Simply adding half a cup of milk or fortified soy milk, which is also a complete protein, provides 4 to 6 grams of protein. This small amount of protein is enough to shift your body from a catabolic state to an anti-catabolic or even anabolic state. It stops the overnight muscle breakdown. And finally, the most powerful tool in this toolkit for combating sarcopenia and anabolic resistance: Whey Protein Isolate. If you are over 60, your body has developed a condition called anabolic resistance. This means your muscles have become less sensitive to protein signals. The amount of protein that used to be enough to trigger muscle protein synthesis, MPS, at age 40 is no longer enough. You need a higher bolus of protein to reach the necessary threshold. Whey protein is that signal. It is extremely rich in leucine. Leucine is the primary signaling amino acid that activates the mTOR pathway, which is the body's main biochemical switch for building muscle. Adding 1 scoop of unflavored whey isolate. Isolate is the purest form, with minimal lactose and fat, provides about 20 to 25 grams of protein. This dose surpasses the leucine threshold for an older adult, triggering a robust muscle protein synthesis response. This is the most effective strategy to start your day in an anabolic state. Okay, that was a lot of scientific information. I understand. Please do not try all 10 ingredients at once. That is unnecessary, and you will not be able to identify which factor is providing the benefit. I want you to choose your intervention path. Ask yourself, what is my greatest physiological challenge? If you have joint pain and inflammation, start with a collagen and turmeric/ginger tomorrow. If you feel weak and are worried about sarcopenia, focus on whey protein. That is your priority intervention. If you have brain fog and want to optimize sport and cognitive function, start with MCT oil and lion's mane. Your coffee is a daily physiological opportunity, a chance to repair, protect, and refuel. Do not waste it. My question for you is, which nutritional intervention will you try tomorrow? Please, let me know in the comments below. I truly read them all, and I want to follow your progress. If you found this evidence-based guide valuable, please click like and subscribe to Aging Senior Health for more in-depth scientific analysis every week. Be well and stay strong.